36-year-old Carolina Kello was diagnosed with breast cancer in 2018 when she was 30 years old. The news of the cancer did not go down well with her as she grew to worry.
I started to realize that that breast was growing smaller, and then it had a dimpling below. So that's when I felt like it was something serious, and I asked a friend of mine who was a doctor.
Kello underwent different treatments, among which was a surgery of mastectomy, and she says her life has never been the same.
Like now, because of surgery, I cannot use my hand so much. Even just within the house, I can't do much because my hand is affected because of surgery.
According to Kello, she has learned to block out negativity and has since joined support groups to help her cope up with this breast cancer. She now urges fellow women to go for breast cancer screening so that they can detect the cancer early and go for early treatment.
Ladies who are scared to screen, for those ladies who think it's better not to know, it's really will not help.
Experts say breast cancer is systematic in that it easily spreads to the rest of the body and the treatment differs for different patients. Breast cancer is the third most common cancer in Uganda. According to experts, the type of breast cancer is generally determined by the origin of the growth of cancer cells, which is almost always in the lobes, lobules, or ducts. This cancer is always caused by damage to a cell's DNA. All people, whether male or female, are born with some breast cells and tissue that have the possibility to develop into cancer. However, breast cancer in men is rare. According to a breast surgeon, Dr. Kathy Chidewala, women are more prone to breast cancer than men.
Women may be after the age of 50, and in men after the age of 60. It is a rare cancer in men, like I said, because the breast tissue formation is very, minimal. And also the hormones that come into play for breast cancer to form are also very, rare.
Dr. Chilewala says several symptoms like lumps, discharge from the nipple, among others, start to show up when the breast cancer is developing, and she urges women to visit the hospital when they notice these signs.
For women who tend to wait, they come in with signs like ulceration on the breast. That is when now the cancer has actually grown beyond only the breast tissue, and it is now attacking the skin.
Although women are so much at risk of developing breast cancer, experts say men too have chances of developing this cancer.
It's so important for men to be concerned about any changes in their breasts, especially swellings or deformities.
Being a woman is already a risk factor. Your lifetime risk for breast cancer is about 13%. Whereas for being a man, your lifetime risk is very low, like, 1 in 900. That's very low.
Majority of women in Uganda are diagnosed at stage 3 or stage 4 when breast cancer is more difficult to treat and the outcome of survival is significantly lower. Some even blame the symptoms of breast cancer to traditional spirits.
We believe there still are gaps in knowledge or awareness about breast cancer and how it presents and how it progresses. There are also reasons like attitude towards this disease.
On diagnosis of breast cancer, there are those who survive it while others live with it. However, doctors say early detection gives more chances of survival.
Usually start with a breast ultrasound scan and a mammogram. These images help us define this lump if we've found it. They define the lump in terms of its size and the different characteristics, which also guide us into understanding which ideally we do a core biopsy, where we take off a piece of the lump tissue and take it for thorough analysis, looking for any characteristics of cancer cells.
After treatment, some surgeries done like mastectomy leave women with either one or both of their breasts cut off. To help cope with this, the Uganda Cancer Society has introduced artificial breasts for women.
It's designed in different sizes, as you may see here, and it also even has a nipple, so it gives you that illusion of a full breast. It is soft, so you will not feel any kind of challenges. They're made in different sizes and according to the different ways people have been given surgery, because some of them go to this side, some of them are partial, and some of them are just both sides being removed.
Early detection is key in treatment of breast cancer. Medical practitioners demonstrate how to perform a self-examination and how they examine women when they report to the hospital.
Right gwe gujja okkebera side ya left, naye n'omukono ogwa left gwe gujja okkebera right. Kati nga kyokola owanika kuba kati wano nkebera mulwadde, kino kye tuliko, naye weba nga gwe weekebera kye ndiko okusomesa, ojja kuwanika omukono ogwa left, okwate omukono gwa right, wenyige otandikire eno mu nkwawa, onyige mu nkwawa yonna ogende ng'onyiga owuliriza, weetoolole ebbeere lyonna olinyige, tonyiga ng'okozesa buno bugalo, wabula okozesa wano makati onyige naye ng'otandikira mu nkwawa.
According to the World Health Organization, breast cancer became the most common cancer globally as of 2021, accounting for 12% of all new annual cancer cases worldwide. Statistics from Uganda Cancer Institute put survival rates of women with breast cancer at 51.8%. Sharon Twebaze, CTV PM Edition.